once you know these definitions, once you know these definitions, it is very easy to like just revise psychiatry. And am I audible clearly? So yeah, so let's start the session, guys. First of all, psychiatry term was coined by. So please remember important one. Psychiatry term was coined by Johann Christian Riehl. Okay, important one. Psychiatry term was coined by Johann Christian Riehl. Okay, it is very much important. Okay, psychiatry term was coined by Johann Christian Riehl. The next one, guys, the next definition that is important to you, that is alexithymia. The next important definition which is there, that is alexithymia. Okay, please remember, alexithymia is what? Alexithymia is inability to express own emotions and understand others emotions. इसका मतलब है वो इंसान ना खुद के emotions दिखा पाता है, ना ही दूसरे के emotions समझ पाता है. Okay, that is known as alexithymia. So लड़कियां बार बार लड़कों को बोलती रहती है तुम मेरी भावनाएं नहीं समझते. So that does not necessarily mean कि every guy is suffering from alexithymia. Okay, so please remember, inability to express own emotion and understand others' emotion is known as alexithymia. Moving further with the next one, that is anhedonia. An important one, that this definition has been repeated twice. Okay, it has been asked in exam twice. So please remember, anhedonia is nothing but inability to derive pleasure from previously pleasurable activities. So you were enjoying cricket earlier, but now you do not enjoy watching cricket once you have started your Fmg preparations. Okay, so this is what is anhedonia. So please remember, anhedonia is a negative symptom and usually seen in cases of depression. People who are suffering from depression usually suffer this feeling of anhedonia, right? Important one. Next one is important, generation of emotions. So इस पे बहुत बार confuse होता है. We tend to confuse in this. So please remember, guys, generation of emotions is the responsibility of limbic system. Generation of emotions कौन करता है? Limbic system. Whereas regulation of emotions is done by the frontal lobe. Okay, regulation of emotions is done by the frontal lobe. Important one. Okay, so generation of emotions, limbic system, like hippocampus, amygdala, all these structures. Whereas regulation of emotions is done by frontal lobe. So usually emotions can be of two types. Either it can be an affect or it can be a mood. Okay, either it can be an affect or it can be a mood. Please remember this. So what is the basic difference between affect and mood? So please remember, affect means a cross-sectional emotional state. That means at a particular point of time, तुम्हें कैसा महसूस हो रहा है? That is what is affect. Okay. So now if you are feeling happy or now if you are smiling, so this is what is affect. Okay. So please remember, an affect is shown outwards. It is expressed outwards. Whereas mood, on the other hand, guys, it is a longitudinal emotional state. Okay. A long-term emotional state. You are feeling sad for a few days. So this is what is mood. Okay. So please remember, mood is for a longer duration of time. Okay. Important one. So this is the basic difference between affect and mood. Both of these are your emotions. Right. Now moving to the next important two definitions, and that are really important. So first of all is illusion and second one is hallucination. Okay. First is what? First is illusion. Second is hallucination. So the basic difference in this. So let's start with illusion. What do we mean by illusion? So please remember, illusion means a false perception of a real object or a stimulus. So for example, तुम्हें एक रस्सी पड़ी हुई है and that you perceive as a snake. This is what is an illusion. So please remember, अगर कोई रस्सी दिख रही है किसी को and that patient perceives it as a snake, so this is illusion. वहां पे रस्सी है, this is a real object or a stimulus, but he has perceived it in some other way. Okay, he has perceived it falsely. So this is what is illusion. Whereas on the other hand, what do we mean by hallucinations? So please remember, hallucination may usually, again, there is a false perception, but this time there is no object or no stimulus. Okay, so in absence of object or stimulus, if the person is perceiving something, that is considered to be hallucination. For example, वहां कोई रस्सी नहीं पड़ रही हुई, then also उस इंसान को या उस patient को अगर snake दिख रहा है वहां पे, this is what is hallucination. False perception in absence of a real object or a stimulus is considered hallucination, right? So now moving further, hallucination के कुछ characteristics होते हैं, right? So first of all is hallucination is vivid. What do we mean by vivid? So please remember, hallucination is very clear and detailed. That person really can describe you the snake, okay, the type of snake, the color of the snake, okay, the length of the snake. So that is so much vivid and clear. Okay, so please remember hallucinations are very vivid. Next one, it is involuntary. Definitely hallucinations are not in your control, right? So that is what we mean by involuntary. And last is that hallucinations usually occur in the outer and objective space, right? You can, like the person would be telling that the things he can see are in the outer space, right? Not inside his body. So that is what is hallucination. So hallucination के 4 important point कौन से होंगे? Please remember, it is a false perception without a object or a stimulus. Second, it is very vivid, clear, and detailed. Third, it is involuntary in nature. That is, it is not in your control. And last, it occurs in the outer and objective space. Whereas, if all these phenomena, first 3 features are present, but now it is occurring in the inner and subjective space. Okay, now he is perceiving something inside his body. So that would be considered as pseudo hallucination. So please remember, when the person perceives something abnormal in the inner and subjective space, that would be considered as a pseudo hallucination, right? So please remember, these 2 are important difference between your hallucination and pseudo hallucinations, right? Now moving further to our next one. Now, as we all know, there are different types of hallucinations. Okay, hallucinations can be of different types according to our senses. We have 5 different types of senses. Accordingly, our hallucinations can be of 5 different types, right? If we can see something abnormal which is not present, that would be visual hallucination. If we can hear someone's voice who is not present, then that would be auditory hallucination. If we can smell something, that is olfactory hallucination. And if we can taste something, that is gustatory hallucination. And the last one, if you perceive some touch, okay, if you perceive some touch, that is tactile hallucinations, right? So please remember, these are the 5 different types of hallucinations which are usually seen. Now, most common type of hallucination overall, if the question is asked, okay, so please remember, the most common type of hallucination overall is what? So please remember, the most common type of hallucination overall are auditory hallucination. Most common type of hallucination overall are auditory hallucination. This is the common question which has been asked. Okay, and if the question is most common type of hallucination in psychiatric disorders, then also the answer remains same. Then also the answer would be auditory hallucination. So overall, or in psychiatric disorders, the answer is auditory hallucination. But if now the question is most common type of hallucination in organic and mental disorder, whenever the brain parenchyma is affected, like in organic disorders like Parkinsonism, or in Alzheimer's disease, amyotrophic lateral sclerosis, in type K disorders where the brain parenchyma is affected, in those disorders, which are the most common type of hallucinations seen, they would be visual hallucinations. These would be visual hallucinations, right? Important one now. Now, just moving on to the next type of hallucinations, those are our olfactory and gustatory hallucinations. Olfactory are related to smell, whereas gustatory are related to taste. Okay, important one. Olfactory related to smell, whereas gustatory related to taste. So olfactory and gustatory hallucinations are usually seen in cases of temporal lobe disorders. Whenever there are some disorders or there are some diseases which affect the temporal lobe, we can see either olfactory or gustatory hallucinations, right? Important one. Okay, please remember this. Along with that, auditory hallucinations are also seen whenever there are temporal lobe disorders. Because iska kya reason hai? Because auditory cortex is located where? As we all know, auditory cortex is located in the temporal lobe, right? Auditory cortex is located in the temporal lobe. That is the reason whenever there is some abnormality in the temporal lobe, we can also see auditory hallucination along with olfactory and gustatory ones, right? Important. Whereas visual hallucinations are seen when? Visual hallucinations. Can anybody answer in the chat box? Visual hallucinations kab dikhenge? When the disease is affecting which lobe? Anybody? When the disease is affecting which lobe? That is easy, guys. Just remember, just recall once ki visual cortex kahan located hota hai. So when we can see visual hallucinations usually would be seen when the disease is affecting, important, when the disease is affecting occipital lobe. Please remember. No, not frontal lobe, guys. Occipital. Very good, Urmila. Yes, the answer would be occipital lobe. When a visual cortex is located in the occipital lobe. So whenever there are diseases which affect the occipital lobe, the person can suffer from visual hallucinations, right? Important. Moving further to the last type of hallucinations, which are really important, not only from psychiatry, but also from FMT point of view, and those are tactile hallucinations. Okay. So tactile means touch. Okay. So when a person perceives an abnormal touch, okay, in absence of any person touching him, those are known as tactile hallucinations, right? So tactile hallucinations are also known as formification or Magnum symptom. Tactile hallucinations are also known as formification or Magnum symptoms. And yaad rakhna, these alternative names are really very important, guys, because at times they do not ask directly tactile hallucinations. They ask you either formification or Magnum symptom, right? Please remember. So tactile hallucinations are also known as formification or Magnum symptom, and they are usually seen in cases of cocaine intoxication. Whenever a person is completely intoxicated with cocaine, he will feel that some bugs or some insects are crawling all over his body. And this phenomena is known as tactile hallucinations. And in cases of cocaine intoxication, it is also known as cocaine bugs. It is also known as cocaine bugs. Important, right? Now moving to next one, that is reflex hallucination. Reflex hallucination is a special type of hallucination. And what do we mean by reflex hallucination? So please remember, guys, reflex hallucination mein kya hota hai usually? So the stimulus would be in one modality and the hallucination would occur in another modality. Iska matlab kya hai? So please remember, you are seeing a person, okay? You are seeing a person. This is a visual stimulus, right? So this is a visual stimulus which is there. But now you hear his voice. He is not saying anything, okay? वो person बिल्कुल शांत है, वो कुछ नहीं बोल रहा है. Then also you are hearing his voice. So this is a hallucination and it is an auditory hallucination, right? So please remember, whenever there is stimulus in one modality and the hallucination occurs in another modality, this are known as reflex hallucination. These are known as reflex hallucination. Important, okay? Please remember this. And usually reflex hallucinations are seen where? So please remember, reflex hallucinations are usually seen in cases of LSD or cannabis intoxication. कहाँ दिखता है वो? LSD or cannabis intoxication. LSD is lysergic acid diethylamide. Okay. So LSD or cannabis intoxication, usually the person suffers from synesthesia, also known as reflex hallucination, right? Anybody can tell me what is the active principle of cannabis? Just tell me what is the active principle of cannabis. Okay. In the chat box. Till that time, I'll move further. Now there are two important hallucinations which are related with sleep. Okay, दो important hallucination है जो sleep के साथ related है. Okay, important one. So these two hallucinations are known as what? So first one is known as hypnagogic hallucination and second one is known as hypnopompic hallucination. Okay, so please remember this. So hypnagogic hallucination occurs while going to sleep. Okay, hypnagogic hallucination occurs while going to sleep. इसमें go आता है ना, so please remember. It is easy to remember this way. Hypnagogic hallucination occur while going to sleep, whereas hypnopompic hallucination occur while getting up from sleep. Okay, so please remember, hypnagogic while going to sleep, hypnopompic while getting up from sleep. Okay, important. So anybody, what is the active principle of cannabis? So please remember, guys, active principle of cannabis is THC, tetrahydrocannabinol. Active principle of cannabis is THC, tetrahydrocannabinol. Always integrate subjects. जहाँ जहाँ ये questions आता है, जहाँ जहाँ FMT integrate कर पाओ, जहाँ जहाँ कोई और subject integrate कर पाओ, always do that, guys. That is really helpful. Okay, important one. Now just tell me, we have discussed about two important sleep hallucinations, hypnagogic and hypnopompic. So both of these hallucinations are seen in which sleep disorder? Anybody? Both of these hallucinations are seen in which sleep disorder? Any answers in the chat box? Hypnagogic and hypnopompic hallucinations are seen in which sleep disorder? Please tell me in the chat box. Till that, I'll move further. Yes, very good, Shivani. Yes, they are seen in cases of narcolepsy. Important. Yes, very good. They are usually seen in cases of narcolepsy. Important one, right? They are seen in cases of narcolepsy. Moving further now to next one, that is prolixity. Okay. So before moving on to prolixity, I would like to tell you important phenomena, guys. ये एक टेबल बना लो भले ही दिमाग में या फिर अपने नोटबुक में कहीं. So the important point is, guys, there are some thought disorders. Okay, there are some thought disorders that you need to know. Once you know these thought disorders, it is very easy to remember all of these different definitions. First of all, there can be some abnormalities in the stream of thought. Okay, there can be some abnormalities in the stream, yeah, flow of thought, when the stream or the flow of thought would be impaired. Second, there can be some abnormalities in the form of thought. Okay, when the form or organization of the thought is impaired. Next, there are some abnormalities in the content of thought, right? When the content of thought is impaired. And last, there are some abnormalities in the possession of thought. There are some abnormalities in the possession of thought, right? So these are the 4 important thought disorders. First of all are the disorders of stream or flow of thought, right? When the stream or flow of thought is increased, okay, that is very rapid. एक के बाद एक thought आए जा रहा दिमाग में, okay, very rapid thought, very rapid ideas coming one after the other is known as what? That is known as flight of ideas. Okay, a rapid sequence of thoughts coming in mind one after the other is known as flight of ideas. क्या बोलते हैं उसको? Flight of ideas. And just a less rapid ordered flight of ideas. Okay, usually in flight of ideas what happens? एक order चली जाती है. Okay, just successive thoughts are coming in mind one after the other and there is no order. Okay, it is disordered flight of ideas, disordered successive thoughts which are coming in the mind. That is usually seen in flight of ideas. Whereas in prolixity, what is the difference? Okay, it is a less rapid and an ordered flight of ideas. That is usually seen in cases of prolixity. So first stream or flow of thought disorder was flight of ideas. Second is prolixity. And the third one would be inhibition, guys. Third one is inhibition. When the stream or flow of thought would be impaired, it would be decreased. धीरे धीरे आएंगे दिमाग में thoughts, right? So please remember, can anybody tell me flight of ideas is seen in which disorder? Flight of ideas is seen in which disorder? Important one, flight of ideas. एक के बाद एक thought आ रहा है दिमाग में. Yes, very good, Namita. They are seen in cases of mania, right? They are usually seen in cases of mania, right? Important. Whereas prolixity would be seen where? Prolixity, less rapid flight of ideas. Less rapid flight of ideas would be seen in a milder form of mania, known as what? Milder form of mania is known as what? Anybody? That is known as hypomania. Very good. That is known as hypomania. Important. Okay. So please remember. Very good. Very good. So a flight of ideas is seen in mania, whereas prolixity is seen in hypomania. And inhibition would be seen in decreased flow of thought. Inhibition is usually seen in cases of, इसका opposite क्या होगा? Inhibition is usually seen in cases of depression. Please remember, inhibition is usually seen in cases of depression. Very good, Shivani. Very good. Now, moving on to the next one, that is disorders of form of thought. Okay, disorders of form of thought are important, guys. So, form of thought मतलब organization of thought. Usually एक thought जो होता है वो organized होता है, right? जिससे कि वो सामने वाले को समझ में आए. But at times what happens when these thoughts are very rapid, so the form or the organization of thought is totally impaired. Okay, so in that case there are different disorders which can be seen. First is derailment. First disorder of form of thought is what? First disorder of form of thought is derailment. Okay, important one. First disorder of form of thought is derailment. So derailment में क्या होता है? Please remember, important one. In derailment, the connection is lost between successive thoughts. So first thought in my mind was my name is Omkar, and the second thought is I live in India. Okay, these are the two thoughts. But what happens usually? The connection would be lost between these successive thoughts. So what I would say, my name is Omkar and India is a beautiful place. So now the connection is lost, right? So this is what is derailment. Derailment means track se hat jana. Okay, patri se hat jana. That is what is derailment, right? So the connection would be lost, right? So important one. And if connection is lost between the same thought, एक ही thought में अगर पूरा connection lost हो गया, right? If I say like my name and मैं भूल जाता हूँ, आगे मैं बोल देता हूँ my name is India. So this is what, एक ही thought में अगर connection lose हो जाता है, that is known as loosening of association. That would be known as loosening of association, right? Successive thoughts के बीच derailment, एक ही thought के बीच loosening of association. I hope this is clear to you. Now the next disorder which is related to form of thought is circumstantiality and tangentiality. These two are very important. Okay. So what do we mean by circumstantiality? If you ask me a question, guys, that what is your name? And I tell you, India is a beautiful place. It has various customs and traditions, blah, 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 blah. Okay, I keep on telling an essay about India. And finally, I land up on the answer that my name is Omkar. So whenever the final goal is reached, that is known as circumstantiality. When the person gives you a final answer, that would be circumstantiality. But if I keep on repeating things about India, if I keep on telling you things about India, and I do not give my answer that what is my name, so that would be considered as tangentiality. That would be considered as tangentiality. मैं अलग tangent पे बात कर रहा हूँ. That means I am not on track. मैं तुमने एक सवाल पूछा है, मैं अलग आंसर कर रहा हूँ. That is what is tangentiality, where the final goal is not reached. Okay, final goal is reached. Circumstantiality, घुमा घुमा के final goal बता देना. Whereas when the final goal is not reached, that is tangentiality. Right? I hope this is clear to you. Moving further, now to perseveration. Perseveration भी याद रख लेना. Perseveration is again a disorder of form of thought. Perseveration is again a disorder of form of thought. In perseveration, the thought is continued beyond a point of relevance. For example, if you ask me what is my name, I tell you my name is Omkar, right? Then again you ask me where do you belong to? I again tell you that my name is Omkar. Then you ask me where you have pursued your MBBS from. I again tell you that my name is Omkar. So here a same thought is repeating beyond a point of relevance, right? So that condition is known as perseveration. So this condition would be known as perseveration, जब इंसान बार बार वही आंसर करे जा रहा है, right? And it is usually seen in cases of organic brain disorders. Okay, it is usually seen in cases of organic brain diseases wherever the parenchyma of the brain is affected, right? Important. Next one is delusions, right? And delusions is the most important one. Okay, please remember delusions पे बार-बार question पूछे जाते हैं. Delusion is the most important one. Anybody can ask you in the examination. So please remember, guys, this delusion is a disorder of content of thought, and this has been asked. इतना easy सवाल पूछा गया है. Okay, so please remember, delusion is a disorder of content of thought. Okay, please remember, delusion is a disorder of content of thought. याद रखना. So here the content would be abnormal, right? So the patient or the person has a false belief. Okay, he has a false belief which is firm, fixed, and unshakable. Okay, and it continues despite evidence against it. इसका मतलब क्या है? Just एक easy example से समझते हैं हम. Okay, so somebody is, some patient is feeling that his neighbor is trying to harm him. Okay, his neighbor is trying to harm him. So this is a false belief. उसका neighbor उसको मारना नहीं चाहता है. So this is a false belief. Okay, but it is firm. उसके दिमाग में एकदम बैठ सा गया है. Okay, fixed है एकदम. It is firm, fixed, and unshakable. उसको तुम हिला डुला नहीं सकते. Okay, and it continues despite evidence against it. That means though you prove that he does not have a neighbor, then also he will feel the same. Okay, that his neighbors are trying to harm him or kill him. Right? So please remember, though you prove it wrong, then also the person would believe in the same thing. So that is what is delusion. So delusion is a disorder of content of thought. It is a false belief which is firm, fixed, unshakable, and continues despite evidence against it. Easy definition. Please remember this. Okay, don't forget this at like any point of time. Moving further now, there are different types of delusions which are seen, but which is the most common type of delusion, guys? So please remember, the most common type of delusions are delusion of persecution. Okay, delusion of persecution, जिसकी अभी हमने बात की. Okay, if the person feels that somebody is trying to harm him or kill him. Okay, that is what is delusion of persecution. If the person feels that somebody is trying to harm him or kill him, that is delusion of persecution. And delusion of persecution are the most common type of delusion seen in schizophrenia. Please remember, delusion of persecution are the most common type of delusion seen in schizophrenia. Right? Important one. So important है ये, याद रखना important. Next one is delusion of love. Okay, next is delusion of love. Delusion of love is also known as erotomania. इस पे भी एक बार question पूछा गया है, guys. Delusion of love is also known as erotomania, also known as fantasy lover syndrome. When a person of lower social status feels that a person of higher socio-economic status is in love with him. For example, a person living in slum believes that Katrina Kaif is in love with him. So this is what is delusion of love. Okay, so please remember, delusion of love मतलब अपने औकात के बाहर अपने से कोई प्यार करता हो ये महसूस होना. This is delusion of love or erotomania, also known as fantasy lover syndrome. Always remember the alternative names because delusion of love was asked by the name erotomania in the examination. Right? Important. Moving further, guys, now to the next type of delusions, which are nihilistic delusion. Okay, next type are nihilistic delusion, also known as Cotard syndrome or delusion of negation. नाम से पता चल रहा है इसके. So next are nihilistic delusion, also known as Cotard syndrome. Important name, Cotard syndrome. Okay, Cotard syndrome or delusion of negation. When the person feels that the world is going to end. Okay, the person believes that there is end of existence. सब कुछ खत्म होने वाला है. Okay, ये दुनिया तबाह होने वाली है. Okay, 2012 वाला scene. Whoever was believing in it, those people were suffering from delusion of negation, right? So please remember, nihilistic delusion or Cotard syndrome or delusion of negation. These are seen in which disease? Anybody? The nihilistic delusions are seen in which disorder? Which psychiatric disorder nihilistic delusions would be seen? Anybody? Important one. Nihilistic delusions are seen in which disorder? Just answer it. Yeah, very good. Depression. So please remember, nihilistic delusions are usually seen in cases of depression. Okay, yaad rakhna. Next one, delusion of infidelity. And this is again important. Delusion of infidelity is also known as pathological jealousy, morbid jealousy, or Othello syndrome. Delusion of infidelity is also known as pathological jealousy, morbid jealousy, or important name, that is Othello syndrome. Kya bola jata hai isko? Othello syndrome. So what do we mean by infidelity? Delusion of infidelity. A person has a firm belief that his partner is cheating on him. Okay, and it is usually seen in males कि वो समझता है कि मेरी बीवी मुझे cheat कर रही है किसी और के साथ. So please remember, delusion of infidelity is usually seen in males, common in males, and in which males? In usually chronic alcoholics. It is common in chronic alcoholics. So the case would describe a chronic alcoholic that has who has a firm belief that his partner is cheating on him. So it is what? The person is suffering from delusion of infidelity, also known as Othello syndrome. An image had come earlier for Othello syndrome. I'll show you at the last of the session. Okay, so the image can come. Moving further to next one, guys. These was about your delusions, different types of delusions, which is what? Disorder of content of thought. So you'll be asking, what are the different disorders of possession of thought? So please remember, as of now, just remember, disorder of possession of thought, जब इंसान को लगता है कि ये thought मेरा है ही नहीं, या फिर मेरा thought है कोई और चुरा रहा है. Okay, so these disorders of possession of thought are known as thought alienation disorders. What? These are known as usually thought alienation disorders. There are three different types of thought alienation disorders, which we'll discuss in schizophrenia. Okay, just thought insertion, thought withdrawal, and thought broadcast. Okay, these are the three different types of thought alienation disorders. Okay, ye yaad rakh lo bas. These are the disorders of possession of thought. I'll be asking you. Moving further, guys, now to some higher mental functions. Right, we have some higher mental functions. The first of which is attention. Okay, so please remember. So for attention, they can ask you which is the test you perform for attention. So for attention, we perform a digit span test or a digit repetition test. We perform a digit span test or a digit repetition test. Digit span test matlab you ask the patient to recite all the odd numbers. So the person would recite 1, 3, 5, 7, 9, 11, right? So this way. So this is known as a digit span test. And next is digit repetition test, when you ask the patient to repeat what you any digit that you would see, right? So that is, these are the tests usually performed for checking or assessing the attention of a patient, whether the patient is attentive or not. So next higher mental function is concentration. Okay, what happens in concentration? The test performed is serial 7 subtraction test. So what do we mean by concentration? Concentration is nothing but the ability to sustain attention for a longer period of time. मतलब तुम ज्यादा टाइम के लिए अगर attentive हो, that is what is concentration, right? So please remember, attention is for a shorter duration of time, whereas concentration is for a longer duration of time, right? So in concentration, which is the test performed? In concentration, the test performed is known as serial 7 subtraction test. Serial 7 subtraction test, important one, right? So in this, you ask the patient to subtract 7 from 100, right? You start with 100 and you ask the patient to subtract 7 each time. So right, So the person would start 100, minus 7 is 93, minus 7 is 86, right? So sorry, minus 7 is 87, yeah, 86, then minus 7 would be 79. So this way it goes backwards, right? So this is known as your serial 7 subtraction test, which is usually done to check or assess concentration, right? Important one. Next one is abstract thinking, and this is important. Question was asked in NEET PG regarding abstract thinking. So what do we mean by abstract thinking? Abstract thinking means ability to make concepts and generalize them. Okay, so ability to make concepts and generalize them is known as abstract thinking, right? So just giving you an example. So if I say a proverb that is pen is mightier than sword. Okay, if I say this proverb, pen is mightier than sword, इसका actual meaning क्या होता है? Okay, pen is mightier than sword means words have more power than what a war has, right? So this is the actual meaning, the deep meaning behind it. So this would only be understood by the individuals who have this abstract thinking in them. Okay, जो concepts बना सकते हैं और उसको generalize कर सकते हैं. But those people who do not have this abstract thinking, who have the concrete thinking, superficially सोचते हैं बहुत ज़्यादा. In those individuals, what they would think, they would take the literal meaning behind it, and they would say this is totally foolish and rubbish. Okay, a pen cannot be mightier than a sword. Okay, this is usually seen in individuals having concrete or superficial thinking, right? So medicine, अगर तुम बहुत ज़्यादा superficially पढ़ते हो तब exams में question solve नहीं हो पाते, right? So that is what is concrete thinking. Whereas if you try to read medicine with actual concepts and try to generalize them, apply them in questions, then that is what is known as abstract thinking, and that is what makes you different from other students who are preparing, right? So this is what I would say always, that try to grasp the concept and then apply it on the questions. That really helps you, right? Now next one, the last higher mental function is insight. Okay, and what do we mean by insight? Here insight means awareness of an illness. Okay, here insight means awareness of an illness. So for example, a patient is suffering from some psychiatric disorder and he is aware of that fact. Okay, that is known as an insight. That is known as an insight, right? There are total 6 grades of insight. There are total 6 grades of insight, but the most important you need to remember is grade 5, which is intellectual insight, and grade 6, which is emotional insight. So what do we mean by this? So I'll just give an example. Okay, grade 5, for example, a person is suffering from seizures who is a chronic alcoholic, right? Those alcohol withdrawal are leading to seizures, right? So this is the basic thing. So now in grade 5, the person is aware that he is suffering from seizures. First thing, he is aware of the illness. Second, he is also aware that these seizures are due to alcohol withdrawal, but he is not trying to change the behavior. He is not trying to change the behavior. This is what is intellectual insight, grade 5. Whereas what do we mean by grade 6, emotional insight? In this, the person is suffering from seizures and he is aware of it. He also is aware of the fact that these seizures are due to alcohol withdrawal, and he also quits alcohol. That is, it changes his behavior accordingly. So now this is what is emotional insight, right? So please remember these two are important ones, right? Now, please remember usually insight is absent in cases of psychosis, whereas insight is present in cases of neurosis. जब भी किसी इंसान को neurological brain diseases है, organic brain diseases, insight would be present. He would be aware of the illness. Whereas whenever a person is suffering from some psychiatric disorder like schizophrenia, insight would be absent, right? याद रखना ये. Okay, important one. Moving further to our next one, and the topic here is schizophrenia. I'll finish schizophrenia today, and then we'll end the session because it should not last too longer, right? So important point about schizophrenia, guys. Now it is very important. Okay, in psychiatry, this is one of the most important topics on which questions have been asked repeatedly. So schizophrenia के बारे में क्या पढ़ेंगे सबसे पहले? Okay, in schizophrenia, which is the neurotransmitter which is usually increased, schizophrenia is a psychotic or a psychiatric disorder in which usually we'll see all the psychotic symptoms like delusions, hallucinations, right? All these symptoms would be seen. So there is some neurotransmitter whose level is increased in cases of schizophrenia. Which is the neurotransmitter? Anybody? Which is the neurotransmitter which level is increased in cases of schizophrenia? Very good, Namita. Yes, dopamine levels are increased in cases of schizophrenia. Please remember, dopamine levels are increased in cases of schizophrenia. Please remember this, okay? Excess of dopamine leads to psychotic symptoms in schizophrenia. Now, let's see important ones now, okay? Important psychiatrists who are known for their work in psychiatry. First is your Emil Kraepelin. सबसे पहले का नाम क्या है? Emil Kraepelin. So Emil Kraepelin, important guys, please remember, Emil Kraepelin, he actually classified the psychiatric illnesses. Emil Kraepelin ने क्या करा? He classified the psychiatric illnesses. Okay. So if a person is suffering from some psychiatric disorder and having continuous psychotic symptoms, okay. So if a person is having continuous psychotic symptoms, he named that disease as dementia precox. He named that disease as dementia precox. Whereas if some person is suffering from episodic illness, right? So if a person is normal other times, but he suffers from episodes of mania or episodes of depression or episodes of any of the psychotic symptoms for a while. So this episodic illness, he termed it as manic depressive psychosis. Okay, he termed it as manic depressive psychosis. So he actually classified the illness based on the appearance of symptoms. If they are continuous, he termed it as dementia precox. And if they're episodic, then he termed it as manic depressive psychosis. Can anybody tell me that out of these two terms, which one is schizophrenia? Out of these two terms, which one is schizophrenia? Anybody? Out of these two terms, dementia precox and manic depressive psychosis, which one is schizophrenia? Very good. Yes. Continuous one is schizophrenia. So please remember, in schizophrenia, usually the symptoms, the psychotic symptoms are present throughout. So dementia precox was the earlier term used for schizophrenia, and that was given by Emil Kraepelin. So this is a question which have been asked. Okay, important. Now next, moving further. Next one is Eugene Plural. Next psychiatrist ka naam kya tha? Eugene Plural. Important one. And Eugene Plural was the one who coined the term schizophrenia. He renamed dementia precox as schizophrenia. He renamed dementia precox as what? Schizophrenia. He also gave some important 4 symptoms of schizophrenia. He said all the symptoms of schizophrenia would be in these 4 groups itself, and they were termed as 4 A's of Plural. Kya bola gaya unko? 4 A's of Plural. So what were the 4 A's of Plural? So please remember, first one is autistic thinking. सबसे पहला क्या है? Autistic thinking and autistic behavior. The person would be socially isolated, अकेला अकेला रहेगा. Okay, and that person would suffer from some language or communication problems, right? So that is what is autistic thinking and autistic behavior. First A. What was the second A? Second A is ambivalency. Ambivalency means inability to decide. मतलब मैं स्कूल जाऊं या ना जाऊं, मैं ये काम करूं या ना करूं. Okay, so inability to decide about any action or any thought, that is what is known as ambivalency. याद रखना, inability to decide is known as what? It is known as ambivalency. याद रखना. Next, third A is affect disturbances. Okay, affect disturbances. So affect मतलब क्या? A cross-sectional emotional state, right? So usually in schizophrenia क्या होता है? The person have no emotions, right? So the person could not express any emotions. So that is known as flat affect or blunt affect. उसको क्या बोला जाएगा? Flat affect या blunt affect. So flat affect or blunt affect is usually seen in cases of schizophrenia. Important one. And the last one are association disturbances. So association disturbances, whenever the association or the organization of the thought is impaired. And these are known as what? These are known as formal thought disorders. These are known as formal thought disorders, right? So the 4 A's of Plural क्या थे? The 4 A's of Plural were autistic thinking and behavior. Second A, ambivalency. Third A, affect disturbances. And fourth A, association disturbances, also known as formal thought disorders. Moving further to next psychiatrist, that was Kurt Schneider. Agle ka naam kya tha? Kurt Schneider. Okay, important one. And Kurt Schneider was the one who gave the 11 symptoms of schizophrenia. Okay, and these are known as 11 Schneiderian first rank symptoms. Okay, Kurt Schneider gave 11 symptoms of schizophrenia, also known as 11 Schneiderian first rank symptoms. And ये 11 symptoms याद रखना बहुत easy है, right? First 3 are thought alienation symptoms. First 3 are thought alienation symptoms. Anybody? I have told you already. Thought alienation is a disorder of what? Stream of thought, content of thought, form of thought या possession of thought? Just tell me. Thought alienation is a disorder of. Yes, very good, Namita. It is a disorder of possession of thought. Very good. It is a disorder of possession of thought. And there are three types of thought alienation symptoms as we have discussed. First is thought insertion. मतलब कोई तो मेरे दिमाग में बाहर से thought डाल रहा है. Somebody is inserting some thought from outside. So that is thought insertion. Second is thought withdrawal. मतलब कोई तो मेरे दिमाग से thought चुरा रहा है. That is somebody is trying to steal some thought from my mind. That is thought withdrawal. And last is thought broadcast. Somebody is trying to broadcast my thought. Somebody is trying to say what I'm feeling right now. So that is what is thought broadcast. These are your three thought alienation symptoms. Next three are made symptoms. Next three are made symptoms. Made matlab forced. Okay, force kya hua? So first is made violation. Matlab a forced motor act is known as made violation. A forced emotion would be known as made affect. Okay, and a forced desire, sudden desire or an urge to do something is known as a made impulse. Okay, what do we mean by impulse? So please remember, impulse means a sudden urge or desire to do something which you can't resist. ठीक है? So kleptomania में दिखता है. Kleptomania is what? A sudden urge or desire to steal things, right? So that is what is impulse, right? So please remember. So made symptoms matlab forced symptoms. Made violation, made affect and made impulse. Next three are auditory hallucination. Next three kya hota hai? Auditory hallucination, right? So first auditory hallucination, and please remember guys, auditory hallucination are the most characteristic symptom of schizophrenia. Kya yaad rakhoge? Auditory hallucination are the most characteristic symptom of schizophrenia. First is third person hallucination. When the person feels that like those two people are discussing about me. Okay, two people are discussing about me. That is what is third person hallucination. Next is running commentary. Okay, running commentary. That the person feels that whatever he is doing, he can hear voices on like whatever action he is doing right now. So for example, if I'm drinking water, so he'll hear that why are you drinking water? So this is all a running commentary which is going on in his mind. Okay, so please remember the next would be running commentary, and third one would be thought echo. Okay, thought echo is whatever he is thinking, he feels that voice, like some voices are saying those thoughts aloud. That is what is thought echo. So please remember three types of auditory hallucinations seen in schizophrenia. First is third person hallucination, two people talking about me. Second is running commentary, voices being heard about every action he or she does. And last is thought echo. Okay, that is his thoughts are being said aloud. That is thought echo, right? So तीन क्या हो गए? तीन thought alienation symptoms हो गए, तीन made symptoms हो गए, तीन auditory hallucinations हो गए. Total being 9. Next one is 10th one is somatic passivity. 10th one is somatic passivity. That means the person feels that he is like if whatever action he performs, that is being guided by some external force or external agency. मतलब वो अपना अगर हाथ उठा रहा है, that is done by some external force. Okay, that is what is somatic passivity. He feels that he is doing nothing. Every action he is doing is done by somebody else, some external force, right? That is somatic passivity. And the last 11th symptom of schizophrenia would be delusional perception. Last symptom क्या होगा? Delusional perception. So इसका मतलब क्या है? For example, please remember by delusional perception, I mean there is a normal perception that this pencil is white. Okay, you can't see this pencil, right? Okay, so please remember a normal perception would be that this pencil is white, and a delusion associated to it would be as this pencil is white, therefore they are trying to kill me, right? So this pencil is white is a normal perception, but they are trying to kill me is a abnormal delusion which is there, and both of these are linked to each other. Okay, so whenever a delusion is associated with a normal perception, that is known as delusional perception. And delusional perception are seen in which disorder? They are usually seen in schizophrenia, right? Important. Now next one, in NEET PG usually they have asked you about prevalence of schizophrenia. एक बार question आता है एम्स में, याद रख लेना, NEET में भी. So the prevalence of schizophrenia in general population is how much? It is 1%. So 1% of the total population are affected with schizophrenia. In dizygotic twins, dizygotic means fraternal twins or non-identical twins. Okay, dizygotic means fraternal or non-identical twins. In those twins, the prevalence is how much? It is 12%. And lastly, मोनोजाइगोटिक ट्विन्स में कितना होता है प्रिवेलेंस? Monozygotic means identical or maternal twins. In those twins, the prevalence increases up to 47%. The prevalence is up to 47%. याद रख लेना, right? Important one. When both mom and dad are affected with schizophrenia, then also the prevalence would be around 40 to 47%. याद रखना. When both the parents are affected. Okay, याद रखना. Next one. Now, the 5 important symptoms. किससे diagnose करते हो? What are all the positive psychotic symptoms in schizophrenia? So एक basic फंडा याद रख लेना guys. What are the positive symptoms? Positive symptoms मतलब कुछ ज़्यादा कर रहा है, that is positive symptoms. The person is hearing more noises. The person is doing some more things. That is positive symptoms. Okay. And negative symptoms means his actions are inhibited. His thoughts are inhibited. That is what are negative symptoms, right? Important one. So let's see the important 5 symptoms which are seen in schizophrenia. First are delusions, abnormal. What of delusions? They are firm, fixed, unshakable belief, which is false, right? And it continues despite evidence against it. First, delusions. Second is what? Hallucinations. And what do you mean by hallucinations? So please remember, hallucinations are what? Hallucinations are a false perception in absence of a real object or a stimulus. Next one is disorganized speech and behavior. Next one is disorganized speech and behavior. The next one would be negative behavior. Negative behavior would be characterized by symptoms like avolition, okay, किसी काम में दिल नहीं लग रहा, apathy, okay, lack of concern or feeling of indifference, okay, anhedonia, inability to derive pleasure, okay, apathy. So all of these things would be usually seen in cases of negative behavior. And last would be your what? These are your 5 important symptoms: delusion, hallucination, disorganized speech and behavior, and negative behavior. These are important ones, right? Out of these, please remember, out of these 5 symptoms, guys, and last one are motor symptoms, guys. Motor, I have forgot. Okay, last are your motor symptoms. Okay, last are your motor symptoms. ये याद रखना. Out of these 5 symptoms, for diagnosis of schizophrenia, at least 2 should be present. At least 2 out of these 5 symptoms should be present. And 1 out of these 2 should be from these first 3, either delusion, hallucination or disorganized speech and behavior. Okay, so 5 में से कितने present होने चाहिए? 5 में से कम 2 होने चाहिए, and 2 में से कम 1 इन 3 में से होना चाहिए. That is delusion, hallucination or disorganized speech and behavior, right? And these symptoms should last for how many months? So the duration is 6 months. याद रख लेना, the duration for diagnosis is 6 months, because in psychiatry usually based on the duration the diseases are named differently. Okay, yaad rakhna, I'll explain it you further. Now just remember, there are different types of schizophrenia which are seen, right? But the most common type of schizophrenia is what? Paranoid schizophrenia. Please remember, the most common type of schizophrenia is paranoid schizophrenia. Now the different types of schizophrenia have been removed from DSM-5, but then also sometimes question have been asked on this, so it is better to remember these. Okay, yaad rakhna. Most common type of schizophrenia is paranoid schizophrenia. So please remember, guys, in paranoid schizophrenia, it is usually late in onset. Anybody, can you tell me what is the most common age group of schizophrenia? What is the most common age group of schizophrenia? Anybody? What is the most common age group of schizophrenia? And schizophrenia affects which sex, male or female commonly? No, please remember, guys, schizophrenia, मैं overall schizophrenia की बात कर रहा हूँ, not about paranoid. Not about paranoid. So please remember, usually schizophrenia affects 10 to 25 years of age group. याद रख लेना, schizophrenia is more common in young adults, young adult males. Yes, very good. It is more common in young adult males. ये याद रख लेना. Okay. So it is earlier in onset, and when schizophrenia is earlier in onset, it has a bad prognosis. याद रख लेना. Whenever schizophrenia is earlier in onset, it would have bad prognosis. And whenever it is late in onset, it would have good prognosis. So in paranoid schizophrenia, which is the most common type, the schizophrenia is late in onset. Yes, right, about 45 around. Okay. And therefore, paranoid schizophrenia has a good prognosis. This has a good prognosis. Ye yaad rakh lena. But the best prognosis of schizophrenia is seen in which type? Please remember, best prognosis in schizophrenia is seen in catatonic schizophrenia, which is characterized by all the motor symptoms. Okay, catatonic schizophrenia, which is characterized by all the motor symptoms like posturing vagara. Okay, so all those posturing and other motor symptoms would be seen in cases of catatonic schizophrenia or motor schizophrenia, which has the best prognosis. It has the best prognosis. Yaad rakh lena. Next one, the worst prognosis would be seen in. So please remember, worst prognosis. I told you, whichever schizophrenia which would be earlier in onset. Okay, whichever schizophrenia which is earlier in onset. Okay, whichever is earlier in onset would have what? Would have a bad prognosis. So please remember, simple schizophrenia is usually earlier in onset and it has negative symptoms. So please remember, simple schizophrenia is characterized by all the negative symptoms like apathy, avolition, anhedonia, all these negative symptoms, right? So negative symptoms जब ज्यादा होंगे और schizophrenia जब जल्दी start हो जाएगा, that would lead to a worst prognosis, which is usually seen in cases of simple schizophrenia, right? Important one. Sometimes it is said that hebephrenic schizophrenia, which is characterized by disorganized behavior. No, please remember, simple has the worst prognosis, followed by hebephrenic schizophrenia, right? Important one. Next one, guys. Now, next one क्या है? First line treatment for catatonic schizophrenia. And what is the first line treatment for catatonic schizophrenia? Please remember, it is only exception. Okay, only exception is catatonic schizophrenia, जिसकी treatment differ करती है. बाकी सभी schizophrenia की treatment same है. Drugs along with behavioral therapy. That is the best treatment for schizophrenia usually, except in cases of catatonic schizophrenia, which is characterized by motor symptoms, where the first line treatment would be intravenous lorazepam along with electroconvulsive therapy. Electroconvulsive therapy में हम shock देते हैं, right? ECT में हम shock देते हैं. So usually we give a benzodiazepine, right? Like intravenous lorazepam is given and then followed by a ECT, electroconvulsive therapy. So first line treatment for catatonic schizophrenia, IV lorazepam along with ECT. This is a question which has been asked. Please remember this. Okay, moving further to a special type of schizophrenia which is known as Vangogh syndrome. अगला type का schizophrenia क्या है? That is Vangogh syndrome. In this, usually the schizophrenia is associated with self-mutilating behavior. It is associated with self-mutilating behavior. Self-mutilating means self-harming behavior. The person would cut himself, he will bite himself. Okay, so all this self-mutilating behavior associated with schizophrenic patient is seen in Vangogh syndrome. Which syndrome? Vangogh syndrome. Anybody can tell me, FMG June 2021 में एक question आया था. I am fond of asking correlated questions, guys. इसलिए पूछ रहा हूँ. Okay, so just tell me, FMG June 2021 में एक question आया था biochemistry से, which is usually a disorder in like nucleotide synthesis, in which you can see a self-mutilating behavior. Disorder in nucleotide synthesis, in which you can see self-mutilating behavior along with gout. Gout के साथ self-mutilating behavior किस disorder में दिखता है या किस syndrome में दिखता है? This is a very important disorder. Anybody? So please remember, the name is Lesch-Nyhan syndrome. क्या बोला जाता है उसको? Lesch-Nyhan syndrome, which is due to deficiency of HGPRT. Okay, you will study it in biochemistry. Now your biochemistry is about to start. Okay, remember this. Important. Now moving further back to psychiatry. So moving further to our drug of choice now. What are the drug of choice for schizophrenia? So please remember, guys, drug of choice for schizophrenia are antipsychotic. Drug of choice क्या होता है schizophrenia में? Antipsychotics. So antipsychotics are usually of two types. Either they are typical antipsychotics or they are atypical antipsychotics. So please remember, typical antipsychotics are usually high efficacy. Okay, they have high efficacy, but they are also associated with the like very important side effects. Okay, please remember, they are also associated with very harmful side effects. And these side effects, which are usually seen with typical antipsychotics, are known as extrapyramidal side effects. Okay, these side effects are known as what? Extrapyramidal side effects, because they affect the extrapyramidal tract, right? So now the question can be asked, which is the most common extrapyramidal side effect seen with typical antipsychotic? So the answer should be acute akathisia. Most common extrapyramidal side effect associated with typical antipsychotic is acute akathisia. What do we mean by acute akathisia? It is also known as restless leg syndrome. When the person is continuously walking, he cannot sit at single place. That is known as acute akathisia. Okay, which is the most common side effect, most common. And the drug of choice for acute akathisia is propranolol. Propranolol is a non-selective beta blocker, Please remember, it is usually used in cases of restless leg syndrome, also known as acute akathisia. It is also used in cases of essential tremors. ये याद रख लेना, न्यूरोलॉजी से क्वेश्चन है, मेडिसिन से. It is also a drug of choice in cases of essential tremors. याद रख लेना. Essential tremors में drug of choice क्या है? Propranolol. Please remember this. Okay. Next one. Now they can ask you which is the earliest extrapyramidal side effect associated with typical antipsychotic. So please remember the earliest extrapyramidal side effect associated with typical antipsychotic is acute dystonia. What do we mean by acute dystonia? So please remember, a group of muscle undergoes a sudden spasm. A group of muscle undergoes a sudden spasm. Okay, that is what do we mean by acute dystonia. So for example, agar jaw muscles sudden spasm mein chale jate hain, that is known as locked jaw or trismus. That phenomenon is known as locked jaw or trismus. Okay, if the muscles surrounding eye undergoes sudden spasm, that is known as oculogyric crisis, right? So please remember, if neck muscle, like that is sternocleidomastoid, undergoes sudden spasm, that is known as torticollis. Okay, so etc. All these type of sudden muscle spasm in a single group of muscles is known as acute dystonia, which is the earliest side effect of typical antipsychotics. Okay, important one. And usually acute dystonia is treated with, so please remember, acute dystonia के लिए drug of choice क्या? Anybody? The drug of choice for acute dystonia can be asked. The drug of choice for acute dystonia are anticholinergic drugs. These are anticholinergic drugs like promethazine. Please remember, anticholinergic drugs like promethazine are the drug of choice. Okay. Next one is your neuroleptic malignant syndrome. Next side effect is neuroleptic malignant syndrome. So this neuroleptic malignant syndrome is usually characterized, okay, by fever. इसमें triad क्या होता है? Important triad पूछा जाता है हर बारी. Okay. So please remember, whenever Dr. Vinayak will teach you anesthesia, he'll also tell you about neuroleptic malignant syndrome or malignant hyperthermia, which is also associated with one of the anesthetic drugs. Okay. So neuroleptic malignant syndrome में triad क्या होता है? First is fever. Okay. First is what? Fever. Second is muscle rigidity. Second क्या हो जाता है? Muscle rigidity. And third phenomena is what? Elevated CPK levels. That is elevated creatinine phosphokinase levels. So please remember this. Okay. And it is also associated with bradycardia. It is associated with bradycardia. This is the exception which is usually asked. They give you tachycardia in the option. So please remember, bradycardia is seen, not tachycardia. Important. Fever, muscle rigidity, and elevated CPK levels are seen in cases of neuroleptic malignant syndrome. Right. So neuroleptic malignant syndrome के लिए drug of choice क्या है? This question has been asked. The drug of choice for neuroleptic malignant syndrome is dantrolene. The drug of choice for neuroleptic malignant syndrome is what? Dantrolene. Important one. Okay. Remember this. Now, typical antipsychotics के drugs के नाम क्या होते हैं usually? These are haloperidol, fluphenazine, flupentixol, thioridazine. All of these drugs are known as typical antipsychotics. One more side effect is important for typical antipsychotics, that is tardive dyskinesia. Tardive का मतलब होता है long time के लिए, dyskinesia का मतलब होता है abnormal movements. So tardive dyskinesia actually means abnormal movements for a longer period of time. This is also a side effect associated with typical antipsychotics. And as we have discussed, schizophrenia क्यों होता है? Schizophrenia is due to elevated dopamine levels, right? It is due to elevated dopamine levels. Now antipsychotics का काम क्या होगा? So antipsychotics will decrease this dopamine levels, right? Antipsychotics will decrease this dopamine levels. So now, can you tell me which is a disorder which can be seen when these dopamine levels are excessively decreased by these antipsychotics? अगर ये antipsychotics dopamine के level बहुत ज़्यादा घटा देंगे, it can lead to some disease known as drug-induced what? That disease is known as what? Drug-induced, when excessive decrease in dopamine is seen in basal ganglia. Pallor of substantia nigra is also seen on biopsy. That is seen in which disorder? Anybody? Decrease in dopamine levels. Important question from neurology, also from psychiatry. So please remember, guys, typical antipsychotics can land up the patient into drug-induced Parkinsonism. As we all know, in Parkinsonism, dopamine levels are decreased. Yes, very good, Sandeep. Yes, the answer would be drug-induced Parkinsonism. Now I need to know from you guys, तुमने pharma पढ़ ली है. Just tell me what is the drug of choice for drug-induced Parkinsonism. What is the drug of choice for drug-induced Parkinsonism? Anybody? A cholinergic drug is given for drug-induced Parkinsonism. What is the drug of choice? Just tell me. Till that time, let's discuss about atypical antipsychotics now. Usually what happens if the person is suffering from these side effects from typical antipsychotics, we change the patient onto atypical antipsychotics. These atypical antipsychotics are not susceptible to cause these extrapyramidal side effects, but they can surely cause endocrinal side effects or other important side effects which are important to remember. Okay, so please remember. Before that, any answer? So please remember, guys, the drug of choice for drug-induced Parkinsonism. इस पे question पूछा गया 2 बार. And the drug of choice is benzhexol. क्या नाम है drug का? Benzhexol, also known as trihexyphenidyl. और क्या बोला जाता है उसको? Trihexyphenidyl. So please remember, anybody if asks you here forth, what is the drug of choice for drug-induced Parkinsonism? Answer should be benzhexol or trihexyphenidyl, which is a cholinergic drug. Important, right? Important now. Moving further to atypical antipsychotics. And atypical, just a minute, guys. Atypical antipsychotics are what? So please remember, atypical antipsychotics are drugs like clozapine, olanzapine, risperidone, all these drugs, right? Same important one. So out of all, the most important drug from atypical ones is clozapine. The most important one is clozapine. So please remember, clozapine is the drug of choice for resistant schizophrenia. What do we mean by resistant schizophrenia? Resistant schizophrenia, when more than 2 antipsychotic drugs were ineffective in the treatment. When more than 2 antipsychotic drugs were ineffective in the treatment of schizophrenia, that type of schizophrenia is termed as resistant schizophrenia, for which the drug of choice would be clozapine, which is a atypical antipsychotic, right? Important one. Now, clozapine is usually associated with many side effects, out of which the most important one or the most common one is cyalorrhea. Most common side effect of clozapine is what? Cyalorrhea. What do we mean by cyalorrhea? That is excessive salivation. Most common side effect of clozapine is cyalorrhea, that is excessive salivation. Okay. Also, you need to remember that clozapine is associated with maximum weight gain. Okay, please remember, clozapine is associated with maximum weight gain. याद रख लेना. Okay, and it is also associated with maximum sedation. सुला देती है drug तुम्हें. It is also associated with maximum sedation, right? But these are the most common side effects. But now there are some dangerous side effects or lethal side effects of clozapine. And what are those? So just remember those important one. Okay, first is agranulocytosis. Okay, most important ones are what? The most important side effect is agranulocytosis. Okay, agranulocytosis में क्या हो जाता है usually? The level of agranulocyte, that is neutrophil वगैरह की level कम हो जाती है body में, and agranulocytosis would land up the patient into severe infections. Okay, will land up the patient into severe infections. याद रखना. Then at higher doses of these atypical antipsychotics like clozapine, the patient can also experience seizures. याद रख लेना. Okay, so agranulocytosis and seizures are very important side effects of clozapine, dangerous ones, right? Next one, what is the duration of treatment? Now we are done with drugs. Along with drugs, please remember guys, अगर वो schizophrenia की treatment of choice पूछते हैं, so the best answer would be drugs, that is antipsychotics along with cognitive behavioral therapy. Okay, best treatment अगर पूछी जाए तो क्या होगी? Antipsychotics along with cognitive behavioral therapy. Okay, important one. So now coming to duration of treatment. Duration of treatment कितनी होनी चाहिए? If the patient has experienced first episode of schizophrenia, the treatment should last for 2 years. But if the patient has experienced second episode of schizophrenia, the treatment should minimum last for 5 years, and it can last for indefinite period of time. It can last till infinity. It can last for indefinite period of time. Minimum it should be 5 years. याद रख लेना ये. Okay. Now these psychotic disorders in which we can see all these 5 symptoms which we have discussed earlier. These psychotic disorders can be differentiated based on the duration. If the psychotic symptoms are lasting for less than 2 weeks, then the disorder would be known as acute psychotic disorder. If these symptoms are lasting for less than 1 month, If these symptoms are lasting for less than 1 month, then the disorder is known as brief psychotic disorder. Then the disorder is known as brief psychotic disorder. And if these schizophrenia symptoms are lasting for 1 to 6 months, that is more than 1 month but less than 6 months, more than 1 month but less than 6 months, then it would be known as what? Schizophreniform disorder. Schizophreniform, matlab schizophrenia jaisi. Okay, schizophreniform disorder. And whenever the symptoms last for more than 6 months, then it can be diagnosed as schizophrenia. Okay, easy. So please remember this. This classification has been given by DSM-5. Okay, important to remember. And now last, we'll end our session with delusions of misidentification. There are two important delusions of misidentification, guys. First one is Capgras syndrome and second one is Fregoli syndrome. So let's understand this. Important question बार बार repeat हुए in topics में से. So please remember this. Capgras syndrome is what? Please remember, Capgras syndrome में a familial person is replaced. A person believes that a familial person is replaced by a stranger. So whenever a patient suffering from Capgras syndrome arrives home, he sees his mother sitting on the couch. He says that you are not my mother. You are some stranger who is trying to act as my mother. So यहाँ पे क्या हुआ? There is a familial person which this person believes that it is a stranger. So this is what is a Capgras syndrome. Whereas the opposite of it is your Fregoli syndrome. The opposite of it is your Fregoli syndrome, in which the person believes that a familial person is imposing as a stranger. That means, इसका example समझ लो Fregoli का. Fregoli वाला person जो है, whoever the patient suffering from Fregoli syndrome, if he is roaming on the street, he'll go to any stranger and say to the stranger that you are my mother and you are trying to act like you are a stranger. Okay, किसी को भी जाके पकड़ लेगा रास्ते में और बोलेगा कि तुम मेरी माँ हो. So that is what is Fregoli syndrome. And Fregoli syndrome में the person believes that the next person is can change multiple faces. Okay, usually फिर उसमें जो image दी जाएगी तुम्हें Fregoli syndrome में, that image has been given earlier. The person will be holding multiple masks. Okay, the next person would be holding multiple masks. So because that person believes that this person can change multiple appearances, right? So ये होता है Fregoli syndrome, याद रखना. Okay, so अपनी माँ को अगर stranger समझ रहा है, that is Capgras syndrome. और stranger को अपनी माँ समझ रहा है, that is Fregoli syndrome. I hope this is clear to you now. And let's end our discussion with this. Next time we'll start with depression, okay, and with some sleep disorders. Yeah, sleep disorders, sexual disorders, eating disorders, and some substance abuse. We'll end our session. I am really sorry for all the inconvenience that happened to you guys due to the internet issues that I had. Okay, so let's meet in the next session. I'll be informing you when is the next session. Thank you so much.